Good afternoon, everybody. I would like to thank the organizers of ISTS for inviting me and giving this opportunity. I also like to congratulate them for this excellent organization. I'm been told to talk about the role of daycare thyroidectomy, and is there any role of daycare thyroidectomy in India? I'm going to talk. This is the flow of my talk. I'll be talking about first little bit about daycare thyroidectomy. What are the advantages of daycare thyroidectomy? What are the safety concerns about it? What should be the selection criteria? What protocols we should follow? What is the most important thing is what is the evidence for and against daycare thyroidectomy, and what is the Indian perspective. This is to some extent a philosophical part of the talk. There is not much of an evidence in India. So we all know that thyroidectomy as an indoor procedure is been practiced for more than 150 years from the time of Theodore Cocker and BILLROTH. But the daycare surgery got popularized in USA from 1970s and 80s. And thyroidectomy as a daycare procedure first performed in 1986. Now we all know that there are definite advantages of daycare thyroidectomy, and this can be divided into advantage for the patient, where it has for a patient it leads to early mobilization and recovery. It leads to reduced, it has a better comfort for the patient, better patient satisfaction it has shown to be. But the most important reason for which the daycare thyroidectomy which has been done is to reduce the cost of the surgery. Cost not only because it is the patient is discharged early, but it also because of the reduced incidence of hospital acquired infection and because reduced requirement of antibiotics which are required to reduce the hospital acquired infections. Also for the healthcare system, because it reduces the cost, it is better for the system, and also because you are increasing the efficiency of the healthcare system. For individual surgeon, you can increase your output, and also you can introduce more surgical advancements. Obviously, there have always been safety concerns about daycare thyroidectomy. If you're going to discharge your patient after thyroidectomy is not a small surgery per se, and if you're going to discharge your patient within 6 to 8 hours of your surgery, then there are concerns which are there, especially of postoperative bleeding, and that can lead to hematoma, that can lead to airway compromise. And airway compromise can also happen because of bilateral recurrent laryngeal nerve injury. It can lead to, you are concerned about hypocalcemia, symptomatic hypocalcemia, even minor complications like postoperative bleeding, vomiting, postoperative pain, vomiting, sedation, you are concerned about. And therefore, this has always been practiced in a very select group of patients. Now, American Thyroid Association has released a certain selection criteria for daycare thyroidectomy. So, inclusion criteria is been for a medically fit patients, that is ASA 1 and 2 patients who are less than 70 years of age with no comorbidities, especially the patients who are not on any blood thinners. Disease wise, the patient should have a disease which is a small volume disease, who should not have any, who should undergo an uncomplicated surgery, not an extensive surgery. Most important part of the surgery is that the patient should have certain patient and relative should have a certain degree of level of education or understanding, and should have a caregiver at home, and should have a nearby healthcare facility where patient should be able to report immediately in case of an emergency. And if patient doesn't fit into any of these criteria, then patient obviously falls into the exclusion criteria. It's not only the inclusion and exclusion criteria, the surgeon has to follow strict protocol while doing surgery, and it's not only the surgery, It starts right from the preoperative anesthesia fitness to even surgical. The anesthesia usually preferred to give a total intravenous anesthesia rather than giving an inhalation anesthesia, which leads to postoperative sedation. While giving a postoperative analgesia rather than giving opioid analgesics, which leads to again sedation, giving NSAIDs, and you prefer giving local infiltration of something like a bupivacaine. Using again IONM helps in preventing, identifying and preventing nerve injuries, and post-operative doing a PTH as well as calcium before discharge is shown to reduce the incidence of post-operative hypocalcemia. Even at the time of discharge, you evaluate the patient properly, and you give a proper discharge advice to the patient, and given a number of healthcare facility is extremely important. Most important is what is the evidence for a daycare thyroidectomy. Now, as I said, the first being done in 1986, so it's been there for around 40 years. But there have not been any randomized controlled trials comparing a daycare thyroidectomy with an indoor thyroidectomy. What we have are just retrospective case series, 11 of them, and there are around 3 prospective series. And there are kind of a systematic reviews, meta-analysis of these retrospective and prospective series. So one being published in 2017, another in 2021, and the last being published in 2024. I don't have time to discuss all these in detail. All these conclude that complication in very good selected patients, the complication rates vis-a-vis hematoma formation, hypocalcemia, recurrent laryngeal nerve palsy, wound complication are comparable, or they are not high compared to the indoor thyroidectomy. So it concludes that in select group of patients, it's a safe procedure. However, the evidence is not a high degree of evidence. It's a retrospective kind of series which is there. And even the patient satisfaction studies have shown that it has a high level of patient satisfaction. And therefore, in US today, it has been done routinely as a daycare procedure. Now, coming last to what is the role in India? Should we do it in India? In last 2 minutes, I'll see it. Must understand why was it done in US, that you must see. The most important kind of a reason why it was done in US is because of the cost reason. And the reason why it was done is because in US, per day cost of admission in US is somewhere between $3,000 to $4,000. And the cost analysis done by Terry Letta showed that if you reduce the cost of admission per day, it reduces cost by around $2,500. And sometimes, if in a post-operative patient, the cost can go up by $11,000 per day. Now, in every country, the cost is different. Obviously, in India, it's not that expensive. And if you see in India, the major cost is of the surgery, and not per day cost doesn't increase to that extent. In India, if you see, especially patients who are getting surgery done through insurance companies usually prefer a kind of a indoor admission rather than a daycare admission. In US, it's other way around. Insurance companies prefer daycare surgery rather than a kind of a indoor surgery. So it's completely other way around. Coming to infection, in US, usually you are concerned about the hospital acquired infections and increasing the cost, and that's the reason why you are trying to send the patients home as early as possible. In India, are hospital more source of infection? Our communities outside are the more source of infection. In fact, outside, we say whether rather than few situation where our community is not very clean, I feel. So again, that reason is not a very sound reason to discharge the patient early. What is the most important concern in India is a safety concern. Unless and until you have a very good caregiver at home and a facility to reach very quickly in case of an emergency, we shouldn't be harping upon a daycare surgery. Today, you send the patient home and patient cannot reach to a facility very quickly, nurse being contactable. We shouldn't be jumping on a daycare surgery. Today, I discharge a patient, even if patient is 5 kilometers away, to reach a hospital, perhaps patient will take 2 hours in the traffic. So we should be very, very careful. Last but not the least is patient satisfaction is different in different country. And just to, again, this is nothing evidence based, but I can give you an anecdotal kind of a report. One of my registrars was doing a study in kind of an open versus laparoscopic surgery in 1990s. Laparoscopic cholecystectomy, and just to prove a point, she used to trying to discharge a patient after laparoscopic cholecystectomy on second, third day. Patients didn't want to go home that early, kind of this thing. In India, patients perhaps are not happy to go home on second and third day. They want to stay till they are absolutely fine. In Japan, after kind of a esophagectomy, they keep the patients for almost a month in the hospital. So every country is different. So yes, my sort of take home message is that yes, daycare thyroidectomy is has advantages. It's been proven to some extent good, not by randomized control trials, but by retrospective studies in American system. But in India, it's not been proven, and to harp upon it in India, if you feel that in your system it works, do it. But I don't think we should just take it and start practicing because it's been proven in US directly. We should jump upon it. Thank you.